I'm Jamilah Hanum, and today I would like to share with you some of the review of the literature that I have done to understand our patients' view when it comes into Ramadan fasting. And I'm going to share with you some of the review of the literature that I have done, and also what can we do as a way forward. We know that we have so many articles, empirical evidences on guidelines, the management and strategies for diabetes control during Ramadan fasting. In other words, we may have the answer whether our patients should fast or not to fast during Ramadan. But the dilemma still exists, and we are very lucky to have the practical guidelines for the management of diabetes during Ramadan by IDF Dar. And in this IDF Dar, we have the information, practical information, and also skills that on how to deliver medical care and support for patients with diabetes during Ramadan fasting. So this extensive literature on diabetes during Ramadan consists of physiology of Ramadan fasting, risk stratification, education programs that are structured in nature, the way to modify our patients' medications, lifestyle adjustment, and etc., etc. And all this to help to ensure our patients could fast in a safer manner. However, how about the subjective feelings of our patients when they do Ramadan fasting and they have diabetes? So we have so many quantitative empirical evidences, and we have limited qualitative empirical evidences. And today I would like to share with you more on the qualitative experiences, the patient's perspective when they are doing Ramadan fasting. When I did some search on the review using quite a number of databases, most of the review that I have found is traditional narrative review, but I have found one very important and interesting qualitative meta-synthesis review that was just published recently by Liao, and I would like to share with you more about this qualitative meta-synthesis review today. The authors have used 12 databases, and they use the spider model in order to manage the literatures that they have found, and they focus on the experiences. And when we talk about the experiences here, it refers to the perspective, attitude, knowledge, perception of religious belief, medication, health education, healthcare providers related to Ramadan fasting of diabetes DM type 1 and DM type 2. And they have included 11 articles in their review. And even though it is only 11 articles, and please remember this is a qualitative research, the sample size amounted to 267, comprised of both T2DM and T1DM, and it was the research conducted at Kuwait, Saudi Arabia, Malaysia, UK, and US. And they also collected the data on participants' medications. And I would like to share with you the 4 categories that they have come out based on the thematic analysis that they have conducted. In these 4 categories that they have found, they have 10 new themes that I believe very important for us to learn today in order for us to understand better our patients' perspective when they do fasting during Ramadan. Number 1 is on fasting, their fasting motivations and the way our patients do their decision making. And based on this paper, it is stated that majority of our Muslims patients celebrate fasting in comparison to only few do it because of the social pressure. So that is their motivation. And their motivations are characterized by they want to perform religious obligations. They want to grasp the opportunity to regulate their body and also mental states. And they want to learn from each other on the best technique to fast during Ramadan. And when we talk about the decision making for them, to fast during Ramadan, based on the research, they have found that they stated that the Quran provided the guidance to make the decision to fast. And the review have found 3 groups of participants. Number 1, despite their disease condition, these participants insisted on fasting. Group number two, these individuals combine their own understanding of diabetes to determine whether to fast or not to fast. Group number three, these participants took a wait and see approach and tried fasting as long as possible. And let's move to the second theme under the same category of knowledge and understanding of observing Ramadan fasting. How about our patients' perspective on exemption from fasting? There are some mixed findings. Some of our patients have a relaxed perspective whereby they believe that people with diabetes could be exempted from fasting. But there are also patients who believe that they need to adhere to the strict mindset, because even pregnant ladies need to fast according to them. And there are also our patients that are in moderate, balanced perspective or moderate perspective, whereby they believe that patients with diabetes could postpone their fasting temporarily. And the third theme under the same category is normalizing the diabetes. According to the review, majority of the participants took their disease for granted, and some of them did not perceive themselves as being ill. Some of them minimized the seriousness of the disease, and some of them ignored the importance of self-management because of these attitudes. So now let's move to the next category that they have found: well-being and challenges from Ramadan fasting. There are 2 themes under this second category. Number 1 is physical and mental well-being. Although some participants with diabetes abstain from eating and even discontinued their medication, they gain both positive physical and mental well-being. This is what reported in the review. And the reasons could be explained by physiological or religious or social aspect. And when we see some of the benefits, the well-being, physically, it means that overall well-being. They have better diabetes management, body weight loss, lowering levels of cholesterol. This is what being reported by the patients. And in terms of mental well-being, it is highly related to religious and also spiritual and also social connection. They reported that they felt spiritually connected to Allah because they believe that the strong faith, the power, the strength to pull through those days when they are fasting comes from Allah. And they felt the connection with people who are suffering in order for them to achieve spiritual sublimation. And they also believe that Ramadan is the best time for them to socially unite with their family members. And when they make a decision to fast, they able to enhance their mental well-being through the social connections that they have established with their family members. The next theme, challenges from Ramadan fasting. For these patients, they consider all the difficulties, side effects, complications, risks, or any other unexpected incidents related to Ramadan fasting as a challenges. They perceive it as a challenges. And these challenges, such as feeling hungry, sick, experiencing blood glucose fluctuation, anxiety or fears of their body condition, they perceive that they are poorly understood by the healthcare providers, lack support from the family or friends, unwilling to disclose to non-Muslim HCPs that they are actually fasting, and other challenges are considered as a challenge. And because these are considered a challenge, they need to continue fasting. And the third category that the authors have found from the 42 findings out of 11 articles is the self-efficacy during Ramadan. And what does it mean by self-efficacy here? Self-efficacy is defined as a participant's belief or skills to successfully manage medication adjustment, regular blood glucose monitoring, diet modification, changes in physical activity, and other relevant lifestyles. So these are the meaning of the self-efficacy during Ramadan fasting. And it can be divided into two themes: medication management and also daily lifestyles. So based on the review that have been done, the medication management can be divided into medication time and also medication doses. And as you can see on the screen, in terms of medication doses, the participants reported that they are mostly self-reliant. They adjusted the doses themselves, and some of them left out medication. Very few of the participants follow the doctor's instruction to change the doses. And in terms of the daily lifestyles, they have the self-efficacy they have quite a number of perspective, some inconsistent findings that we have found. In terms of diet, some believe that if they break their fast using dates, it could cause poor glucose control, but some believe that it could restore normal blood glucose levels. And majority of the patients reported binge eating because they could not withstand food temptation. And mixed findings have been found in terms of their physical activity. Some that are feared of hypoglycemia, they decrease their daily activities. Those who were physically active, even before Ramadan, they will increase their movement because they believe that sports could offer benefits. And those who are neutral, they propose or they believe that walking is the best choice during Ramadan. And the fourth and final category of the review is participants' needs and expectations. And I would like to focus on this. In terms of the Team 8 Ramadan Focus Education Program, Daphne course, dose adjustment for normal eating have been found that 95% of participants consider that as Ramadan focus education as important, and they did not seek medical information after attending Daphne because they could fast in a safe manner. Only majority of the participants stated in the literature that they consider instructions from the HCP was good enough and extra education such as Daphne may be redundant. Team 9 participants' perspective on instructions from healthcare providers. It's quite controversial in terms of the role of HCP. According to the review, the participants or the patients would like to seek advice from the healthcare providers who are, number one, trained, who are able to show empathetic responses. Number 3, realize the religious significance, understand about Islam. And they refuse to seek HCP's consultations if they will be advised not to fast. They are fear of being advised not to fast. Number 2, they believe that they are confident, they have self-efficacy, they are self-reliant due to the previous experiences when they fast in the previous year. And they think that HCPs were incapable of guiding them due to a lack of expertise and deficient awareness of Muslim faith. And sometimes they are unwilling to disclose their fasting to HCPs because they are dissatisfied with their rules. And team number 8 and number 10, this is the final team. In terms of social support and influence, there are mixed findings. They do report experiencing social pressure. For example, some of the family members ask them to fast. Some of the family members would like them to quit fasting. So they have this what we call cognitive dissonance. They have the guilty, whether to themselves, to the religion, or to their family members. And there are also colleagues at the workplace who may do some social pressure, but according to the review, those who conceal their diabetes or fasting behavior at the workplace were at risk of more problems. Recent research in Malaysia in 2021 also shows similar findings on the perception and behavior of type 2 diabetes patients towards diabetes management during Ramadan, conducted by Lee et al. So they believe that fasting could improve general well-being. They're able to fast during Ramadan without difficulties. And this is very interesting. the patients reported that they never experienced hypoglycemia while fasting, but this is only for 32 diabetes mellitus type 2 patients in specific hospital. And what are the way forward? And I would like to quote Liao et al. They mentioned that the authors mentioned that insulin-dependent individuals call for special concern during Ramadan fasting, and Ramadan-focused education need to be generalized, and existing guidelines should be improved. And professional healthcare providers, please weigh the health risk and mental satisfaction for the patients, partly to balance health and religions, and involvement of religious scholars and also psychologists to help in constructing the distorted mindset about fasting during Ramadan probably will also be helpful. I think that's all from me. Thank you so much.